Analyzing best and worst empirical studies. The purpose study of the best article is to determine if sleep amount, sleep disturbances, and sleep patterns are related to obesity in children and adolescents. Determining how sleep and obesity are correlated has many factors affecting obesity. Sleep amount is a factor because it is the number of hours slept per night. Sleep patterns are circadian rhythms, and this can affect pathophysiological mechanisms. Sleep disturbances can happen by nocturnal awakenings. The purpose of the worst study is to understand how sleep duration impacts weight in Mexican American children. Latina children suffer from the highest obesity rates. Being able to understand how these children sleep can help to solve their obesity problems. And not only do they suffer from obesity, but they have also been documented that Latinos have insufficient sleep patterns. The study design of the BEST study is a cross-sectional study. The youth were aged 8 to 17. Weight and height were measured by standard anthropometric measurements. Weight and body fat percentage were measured with bioelectrical impedance scale. Sleep duration was done by self-reports in response to set questions. A sleep habits questionnaire measured sleep disturbances, and sleep patterns were measured with self-reports, bed, and wake-up times. The worst study is a longitudinal cohort study. It is a 24-month study with 8 to 10 years old children and their moms for a total of 229 participants. Mothers have to be members of Kaiser Permanente, Northern California. Families were interviewed at home visits. It was a parent-child interview during home visits. Researchers' assistants who spoke the preferred language did the interviews. Height and weight were measured by standard procedures at 12 and 24-month follow-ups. The study findings for the BEST study was that sleep was reported as good in roughly 9 hours during the week. The findings were consistent with prior research. There is little correlation with sleep duration on school nights and weekends. Large correlations were for oversleep during the weekend. Sleep during the week was associated with waist and hip circumference. Sleep quality was associated with all measures. The worst study concluded that children slept an average of 9.5 hours. Some data was not completed for pre-treatment, 12-month, and 24-month follow-ups. Most children were short sleepers, and 18% met sleep recommendations for age. Longer sleep was correlated with a lower BMI at the end of the 24 months. Now on to internal validity. Sleep duration, pattern, and disturbances are needed to be able to understand the diverse factors affecting sleep. Puberty was controlled due to the population being from 8 to 17 years old. This would help to control different sleep patterns of the participants getting older. Weight and height were measured twice, calibrated, and tested for accuracy to decrease measuring error. This study concluded that sleep and obesity are correlated. For the worst study, waist and height and BMI were not taken for all participants at follow-up points within the study. Lack of data could skew the results that sleep and obesity were correlated. Genetic predispositions to obesity for this population was not accounted for when concluding the results. Interviews were conducted at home visits. This could lead to increased behavior amongst the child and mother being interviewed. The study concluded that sleep duration does affect obesity. External validity. The study is relative to the population. Caucasians, Asians, African Americans, Latinos, and others are races within the study. This is relative to the population because of the variety in races. There is a decent sample size of 240 from ages 8 to 17. All variables were taken into account for sleep measures, height, weight, and covariates of socioeconomic status, locomotive motor activity, and pubertal status were measured. Sleep measures, height and weight are very directly correlated to understand the correlation between obesity and sleep amongst children. In the worst study, Mexican American children were a part of the study with their mothers belonging to Kaiser Permanente, Northern California. This is very specific and does not correlate to the whole population. There is a decent-sized sample of 229 participants from 8 to 10 years old. Only half of these participants were being tested because the other half was their mothers. Interviews were conducted by clinical translators, which may have led to some translating errors. An incentive of $70 was also given for children and their mothers who participated. Sleep duration and BMI were measured for variables. The need for further research. Both of these studies would benefit from not using interviews to gather information, but it is useful and easy to use when children are being studied. The information gathered from parents can be biased. In the worst study, more factors should have been added to be able to fully understand everything involved with sleep and childhood obesity. There is a need for studies to be longitudinal because it is hard to determine sleep and weight correlation within a short period of time, but a longitudinal study is expensive and time-consuming. And these are my references.